This is the first webinar in a three-part series. Sessions featuring Acuity Connect and Acuity Complete Care are scheduled for April and May. Please visit the webinar section of tcshealthcare.com for additional details and to register. We are pleased to have three fantastic speakers from the TCS team. Jeff Frater, Director of Partner Development, Linda Killian, Manager of Client Services Operations, and Deborah Keller, Director of Client Services. Before we begin the presentation, please be informed that today's webinar is being recorded and the attendee phone lines will be placed on mute throughout the program. You are encouraged to submit questions by using the question feature in the GoToWebinar control panel. At the end of the program, with time permitting, the speakers will address your questions. The TCS team will follow up with any that they do not have time to address directly via email. Contact information for the TCS team will also be displayed at the end of the presentation. Also, please recall that this is a brief demonstration intended to review some of the newest features of the Acuity system. For a complete demonstration of the full capabilities of this comprehensive care management software solution, be sure to ask for follow-up contact. At this time, I'd like to turn the presentation over to Jeff Frater.
Thank you, Jessica, and thank you to all of you who have taken time to attend this session and learn the exciting new features in Acuity Advanced Care version 7.20. My name is Jeff Frater. I'm Director of Partner Development here at TCS. I'm a registered nurse with 20 years of case management experience and am responsible for all sales and marketing activities at TCS. I'm going to ask the other speakers to introduce themselves as well. Linda?
Thanks, Jeff. My name is Linda Killian, and I'm the Manager of Client Services Operations. I've been in the IT industry for over 30 years, and I've been with TCS Healthcare for 14 and a half years.
Great. Thank you, Linda. Deb?
Hi, I'm Deborah Keller, Director of Client Services here at TCS. Like Jeff, I'm a registered nurse with several years in the managed care space. My areas of responsibility here at TCS include overseeing technical support, client engagements, including fee-for-service arrangements, as well as implementations, and also partnering with Jeff on new clients.
Thank you, Deb. Okay, before we get started, I did want to take just a moment and review the topics that will be covered during today's session. So first, we'll start off with a TCS company overview to help you understand who we are as an organization and culture. We will also take a few moments and look at the Acuity product suite to understand all of the parts that are included there. Then we will look at the new features in the version 7.20 and feature a product demonstration focusing on those new features. We'll finish up our session today giving Deb an opportunity to talk about the implementation process as well as ongoing technical support. So first we're going to ask Linda to talk to us a bit about the TCS history and culture.
Great. Thanks, Jeff. Well, we felt it would be very important for you to know a little bit about TCS and some of the things that make TCS different from some of the other care management software vendors. First is the fact that TCS is a privately held firm with 32 years of experience in developing care management software solutions. Our founder, Rob Pock, developed his first utilization management software program after he met a director of for a health plan in Los Angeles who asked for a software that would help her nurses get authorizations loaded into her claims system. One of the things our clients tell us that sets us apart is our culture of service. In fact, many of our clients will refer to TCS as a partner and not merely a vendor. During our time, we have focused exclusively on care management software. You'll see the clinical focus and thought in the product that enables Acuity to be such a robust platform in support of care management programs. Finally, we are very proud that during our entire history, we have never had a client fail in implementation. We believe this is a testament to the care we take in identifying clients and supporting their implementation process. One of the things our customers tell us that makes Acuity such a powerful tool for them is the flexibility and configurability of ACUITY to support many diverse care management workflows. The ACUITY platform was first released in 2005. Since that time, we've continued to build and improve upon this platform to ensure that it is capable of providing support for all types of care management operations, including utilization management, case management, disease management, population health, quality improvement, and many others. As you can see in this slide, our current client base uses ACUITY to support a wide range of CM operations. You can see that about 90% of our clients use ACUITY in support of their complex case management programs. 80% use ACUITY for their disease management programs. 75% document and enhance their utilization management programs, either concurrent review or prior authorization. You can also see the breadth of care management programs that the platform can support. This is a testament to the flexibility and comprehensiveness of our software platform. This slide helps to illustrate one of the defining characteristics of the ACUITY system, the fact that it is truly a member-centric application, allowing data to be organized in relation to the patient. Here, the two pink bubbles labeled coverage can represent sequential coverage. For example, a patient was eligible for a span of time, became ineligible, and then again, secondary coverage would be the newest eligibility period. But the coverage can also represent concurrent. For example, a member who has primary coverage through their employment and secondary coverage through their spouse's employment. And very importantly, this can also include those dually eligible members who have coverage through both Medicare and Medicaid simultaneously. Through this, we were able to see holistically all records that have been generated over the span of different eligibility periods for the same patient. Also, this allows for patients that might have coverage through different carriers to still be recognized as the same person and allow the user to access all relevant records housed in the ACUITY database for that patient, regardless of their coverage periods. This slide also helps us to see how records are organized within the application. You can see how notes, tasks, assessments, attachments can be stored either as subordinate records to authorizations, enrollments, referrals, and cases, or as subordinate records to the member's coverage record itself. Again, one of the defining characteristics of the ACUITY platform that our customers tell us is a key strength and why they value this platform to the degree that they do is the flexibility that the platform will meet their specific business needs. Previously, I told you about how ACUITY is able to simultaneously support various care management workflows. But it is important to also note that ACUITY can be configured to support your organization's or departmental specific workflows and data gathering requirements. On this slide, we see that after completing a workflow assessment, we are able to use field properties to support business logic. This allows the system to support your specific workflow needs and standardize data collection while automating many functions. This allows your clinical staff to focus on the tasks and actions that truly require their clinical skills and judgment. Examples of field properties that can be configured include changing field labels, or what a field is called on the screen, making a field mandatory, editing the drop-down list of choices, having fields populate automatically, like today's date, having fields hidden when not applicable, or disabled when conditions have been met, calculating values like BMI, and very importantly, triggering other actions within the application. Triggering can include such things as automatically creating a follow-up task, automatically generating and assigning an assessment to a user, creating a welcome letter, and submitting the letter for batch printing. Together, the use of field properties allows Acuity to support your organization's specific needs, business rules, and data collection, all the while improving your staff's efficiency. And now Jeff is going to talk to us about the Acuity suite of products.
Great, thank you, Linda. So as you can see on the slide in front of you, in the center, Acuity Advanced Care, that's the core system that we are exploring today. But we did want to take some time and explore with you the various add-on products, other modules and options that are available with the Acuity Advanced Care application to offer a comprehensive solution. At 12 o'clock on the clock face, you see the blue logo for Acuity Connect. Acuity Connect is our collaboration portal, a web portal that talks in real time with the Acuity Advanced Care database. Acuity Connect will be featured in our webinar next month, and we will explore that very exciting new offering from TCS. At 2 o'clock on the clock face, we see the red logo for AccuStrat. AccuStrat is a utility that accompanies the Acuity Advanced Care database. It allows for stratification and automation within the application. A very rudimentary example of how AccuStrat might work is to apply filters to data elements within either the Acuity Advanced Care database or another database that is accessible to AccuStrat. Apply those filters to identify patients with the diagnosis of diabetes who are not currently enrolled in a diabetes case management program and have not had an A1C drawn in the past 12 months. The AccuStrat then, after identifying this population, can create automatic follow-up tasks in the Acuity application for a nurse or other user to reach out to the member, to reach out to the member's PCP, and can also generate reminder letters for both the patient and the patient's primary physician. Again, the AccuStrat utility is a powerful utility that helps improve quality operations and improve the efficiency and automate various actions within the Acuity Advanced Care application. At 4 o'clock on the clock face, we see the yellow logo for AccuPort. AccuPort is an extract, transform, and load utility. Quite simply, this utility allows us to move data into and out of the Acuity Advanced Care database. Again, the intent is to allow the clinicians using the Acuity Advanced Care to focus on those tasks that require their time, not manually entering data that could be automatically loaded. At 6 o'clock on the clock face, we see the light blue icon for AccuPrint. Simply put, AccuPrint is a batch printing utility, again, that accompanies the Acuity Advanced Care database and allows letters and educational flyers to be printed during the off hours. At 8 o'clock on the clock face, we see the orange icon for AccuTab. AccuTab is an optional tab that can display information within the Acuity Advanced Care database. One of the most common uses for the AccuTab is to display claims history. The rationale here is quite simple. If the clinical staff using Acuity are able to view the claims history of a patient inside that application, are not required to go to a claims application and find the claims information there, they're much more efficient and much more able to quickly access the information that they need. Again, AccuTabs can display many different types of data elements within the Acuity application. Finally, at 10 o'clock on the clock face, we see the purple logo that is the icon for AccuCare. The Acuity Advanced Care features care planning functionality. It comes with general health and wellness care planning content. The AccuCare clinical programs are diagnosis-specific clinical programs that are optional and can be added to enhance the case or disease management operations in state standardize the care planning functions for asthma, COPD, coronary artery disease, diabetes, heart failure, and high-risk pregnancy. Now, let's go ahead and take a quick look at a high level of the improved features we're going to find in ACUITY version 7.20. These are the features that we'll be demonstrating for you in the application here in just a few moments. The first thing that we'll notice is an improved user interface. The whole look and feel of ACUITY has been dramatically overhauled in version 7.20 with an eye to make the user interface familiar. We've added a ribbon bar. The ribbon bar is a command bar that is across the top of the application. It improves the user's ability to quickly get to the commands that they need. And the ribbon bar can also be hidden from view, allowing more screen real estate for the documentation screens if need be. One of the features that folks are very excited about is My Work List. And we're going to find that when we launch the application, we initially land that we have a work list that features items that are due today or tomorrow, items that are past due, and items that maybe don't have a due date assigned to them. We've added a left navigation bar. The left navigation bar is, again, an ability, it creates the ability for the user to quickly navigate to other sections within the ACUITY application. And very importantly, this left navigation bar can be configured by the individual user to best reflect both the work that they do as well as their personal preference in how they access work that they may need to do. The care planning grid is an exciting development. This allows the care plans to be displayed in a format that would be much more familiar than previously. And what I mean by this is quite simply, most of us learned how to do care plans on paper, and the care planning grid evokes that familiar visual representation. And then finally, in ACUITY version 7.20, we've made it much simpler to create tasks for individuals. Most every documentation screen has the ability to be assigned to an individual as a task. And now let's go ahead and go into the product. And Linda is going to drive as I narrate. Okay, so this is the landing page. When you first open ACUITY version 7.20, this is what you'll see. One of the first things I would call attention to is the fact, again, that the overall user interface is very familiar. It is intended to be reminiscent of modern office software that folks would be familiar with. And the whole purpose here, again, is to improve the user experience to make the software more intuitive and familiar. Next, the ribbon bar. Again, the ribbon bar features many of the commands that might be used by the user in their use of the application. One of the things that we've found is that many of those same commands can be accessed multiple different ways. And in fact, oftentimes folks are relying on the left navigation bar quite a bit. And so, in fact, we have the ability to hide or pin this ribbon bar, again allowing greater real estate for the use of the application. And you can see Linda just hid the ribbon bar there. Now we're going to take a few moments and look at the left navigation bar. This displays 26 active links to various work areas within the ACUITY system. For example, the most commonly used areas you see here are members, authorizations, referrals, case, and care enrollments. Within each of these modules, the user can find a quick list. We refer to these as a browse or a view of all the items within each respective category. For example, when Linda clicks on members, she will see a list of all the members, these are patients, clients, or beneficiaries, that her role-based security allows her to access. Once she opens that respective browse, she has the option to apply quick filters to apply and organize her view. Now, Linda is going to click on authorizations. We are seeing the top 100 authorizations that exist within ACUITY. You'll notice that Linda can apply quick filters now to adjust the view of the records displayed. For instance, she's applying the quick filter of suspended, so that we're only seeing those authorizations that are in a suspended status. She can then select Reviewer, Mine, so that she is now seeing only authorizations that are assigned to her and are also in a suspended status. You'll note that the other quick filters she can use to tailor her view to the work that is most important to her at the time. Now let's return to members. Here, Linda can click on the module members, see a top view of the members that her role-based security allows her to access. You'll notice there are content-specific quick filters for each of these browses. Within the browse, Linda is able to do several key things. She can double-click on any line to see the full records that the line represents. She can also use the green search bar to refine the records within the view and find the specific records she needs to work with now. For example, in the member browse, Linda can click on the last name. She'll then type the last name Dawson, and what we'll see are all members within Acuity that have the last name Dawson. She's also able to apply a secondary search, such as first name or date of birth. Through this browse, she's able to find any members or other records that require her attention and work with. Linda has demonstrated the ability to customize the view within the browse by simply dragging the date of birth column to the left and saving that for next time. In this, she's able to configure the user interface to more closely match her unique needs. And now, Linda, will you reset the search so that we're again seeing all of the records?
There we go.
Very good. Thank you. So other important browsers that Linda may want to have in her left navigation bar include referrals, case, or care enrollments. In fact, care enrollments is a fantastic way for Linda to see all of the case management cases that are assigned to her. One of the other very exciting things that we find in Acuity version 7.20 is the work list. So it's important to recognize that this is the view that the user has when they first log into the application. You'll notice that Linda's hovering her cursor over the announcements. So super users or supervisors within the system have the ability to set announcements that are at a departmental level, at the team level, or even potentially at an individual level. And you can see that we've assigned a relative importance of high, medium, or low with the color indicators on those pins. The other part of this, my work list that probably would capture our attention are work items that are due today, work items that are due tomorrow, work items that are past due, and work items that do not have a due date associated with them that are unscheduled. Work items or tasks can include any number of different record types. And so in the record types, we'll notice an inpatient service or an inpatient review, assessments or tasks. We also may notice care enrollments. So again, these work items can represent any number of different type of record types that have been assigned to Linda with the due date. Now, how do these work items end up on the work list? Well, they end up there either through a series of manual or automated events. Some of the most common manual ways that work items end up on the list would be Linda was doing work with a patient yesterday, and she needed to assign a task to herself to follow up today. Of course, Linda may also be in a job share situation. Perhaps she's a nurse working in partnership with a social worker, and they assign work to each other. Oftentimes, work items are assigned manually by a triage individual who takes all incoming referrals or calls and then pushes those out to staff members. Or perhaps a supervisor doing some load balancing or case assignment. So those are all examples of manual ways that tasks end up on Linda's work list. But there are also automated ways that tasks can end up on Linda's work list. For example, we talked about the ACUITY utility that automates actions within the application, finds a population, and then can assign tasks to either an individual or a team or group of individuals. That's one automated way. Tasks also can be automatically assigned to Linda when she's doing work, and field properties trigger follow-up actions and can assign those, again, either to Linda or a team of individuals. And then finally, one of the ways that tasks are more automatically ending up on Linda's work list is if a provider or other care team member is using the Acuity Connect web portal, and they're submitting an authorization request or sending in messages or sending in records, and those are being routed to Linda. So that's my work list and the various ways that items end up on the work list. Finally, want to point out that any of those items in the work list, Linda can quickly and easily access the documentation record simply by double-clicking on that particular record. And in this case, she's opening Mr. Thomas's care enrollment or his case management case. Okay, so now we're going to change directions a bit. We wanted to show you the care planning grid. So what I'm going to ask Linda to do is navigate to the member Lindsay Dawson. She'll do that by clicking on the left navigation bar, and then she'll use the green search bar to search for Lindsay by last name first. And then she can either double-click Lindsay's record here, open her member record. Once her member record is opened, we see Linda resizing this. We see some of her demographic information and coverage. You'll notice there's a tab for authorization. That would be where she might do her utilization management work. We see a tab for referrals. We see a tab for cases. Cases tend to be transition, short-term transition management type of scenarios. What we wanted to do, though, is look at care enrollments. Care enrollments are either case or disease management cases. The care enrollment functionality includes care planning functionality. And so Linda has opened the care enrollment. We see the cover sheet here. What happened is previously Linda was working with this member, and she had completed an assessment, and that assessment triggered a care plan. And now what we're able to see is the care plan grid. And so again, what we're seeing here is the care plan grid, new functionality in version 7.20 that displays the problems, goals, interventions, and outcomes. Displaying the care plan in this format allows the case manager to see the care plan from a more broad perspective, and then Linda, in this case, can click on any of these care plan elements to update and document the details of her interaction. Notice Linda is going to click on the intervention Assess Knowledge of Asthma Signs and Symptoms. And in the pane below the care plan grid, she can, we see that the documentation is visible for her to update directly. In this care plan grid, she can horizontally see the relationship between problems, goals, interventions, and outcomes. In other words, here she can easily see the interventions that are in support of this problem, inadequate knowledge related to signs and symptoms of asthma. This helps her to maintain a holistic view of this patient and dramatically improves the efficiency by which she can see and update documentation on the care plan. From the care enrollment overview screen or face sheet, we can also see that she is able to quickly generate a printable or emailable version of this care plan. There's that same care plan, but in a PDF version. Next month in the webinar for Acuity Connect, we're going to show how this care plan can also be shared with collaborators via the Acuity Connect web portal. Not want to miss this exciting development and product from TCS. One of the last new features in version 7.20 that we wanted to explore with you today is the simpler task creation. This allows us to place a task owner and next review date field at the top of virtually every documentation screen. This enhances the user's ability to set reminders for themselves when working within this application. Notice Linda is still working with the asthma intervention, assess knowledge of asthma signs and symptoms. She wants to reinforce this with this patient and follow up with this patient in the future. So here she sets the next review date, she assigns this to herself, and she's able to specify, call this patient regarding education. What this will do now is it will push this out onto Linda's My Work list. And again, this task owner functionality is at the top of virtually every documentation screen within the application. Overall, this should be improving the efficiency of the staff members using the Acuity application. So again, this was version 7.20 in a high-level overview. It was not intended to be a full demonstration of the Acuity application, and of course we would be happy to arrange that with you individually. Now what we're going to do is we're going to return to the slide deck, and we're going to give Deb an opportunity to talk about the implementation process as well as technical support.
Thanks,
Deb?
Jeff. As Linda mentioned, and again, as Jeff and Linda just demonstrated, the Acuity Suite is really designed to support lots of different workflows. And thus, we get a lot of questions about how do we implement the Acuity Suite in such a way that, again, as Linda mentioned, we've had 100% success. And I think the key, our secret, is the fact that we don't have a standard implementation process, in that we meet with the clients and we actually customize how we do their implementations based on what the client needs. We truly meet the new client wherever the new client is. Part of that is that we actually offer two different approaches to how we do implementations. One of those approaches is that we do the configuration, and that takes a time frame of between 4 and 6 months, typically. And we also offer the option of a new client choosing to do their own configuration with us training them as we go. And in that situation, 6 to 9 months is the typical time frame to complete the implementation. And we understand that there's a lot of decision drivers that cause a new client to choose one approach over the other, such as competing projects, limited resources. And so again, we meet the client where the client is, and we develop the correct approach to meet their needs with them. Regardless of the approach, we offer a dedicated project manager, an experienced team that consists of 0 consultants. We have a complete team of implementation specialists that are TCS employees, with an average tenure on my team of over 7 years. I'm very proud of that. And again, we work with you to develop a custom project plan to meet your needs. So we do break down the implementation into 4 distinct phases. And the approach that we have represented here is with TCS doing the configuration. So again, meeting the client, the new client, where they are, we begin by, of course, having a kickoff meeting with you and developing your approach to the project that works for you. We, of course, then will implement or install our products. And then we come on site and do an implementation assessment. And this is where we really sit with you. We spend a lot of time understanding your business, your workflows, what you're trying to achieve, and understanding your as-is workflows what you're doing now versus your to-be workflows or your desired workflows. In other words, finding your pain points and your opportunities to gain efficiencies. And then we also do an overview training to help you really understand what can be done in the Acuity Suite via some functionality training as you begin to make those decisions about your to-be workflows. So then we go into more of the technical piece of the implementation, and we talk to you about your data loads and getting those specifications to meet your needs so that you can report robustly across your business at the macro level, and then also all the way down to the individual member level. So we gather your workflow requirements as we go, defining again your to-be workflows, and then we begin workflow configuration sessions. And these are sessions where we are showing you what can be done in Acuity and working with you to decide what the best way to use the system is for you. Because again, the Acuity Suite is very, very flexible. There's no less than 3 ways to do anything, and so we work with you to find the best way that meets your needs. And then, of course, we work with you to develop the reports and letters that you need. We do offer a robust suite of out-of-the-box letters, but then we also know that each client has their own individual needs in this area. So we do have report writing expertise that we offer as part of the implementation. Then we move on to testing after the system is configured, and we've configured it based on what we've heard to be your needs and how you want your workflows to go. We ask you, the client, to go through and really test what we've done and accept it. If there are items that need remediation, then we fix those items and we have you test it again. Once that's completed, we move to end user training, and this is where we partner with you. We help teach the end users the functionality of the system as you teach your new users your specific business processes and desktop procedures. And then we have the excitement of go live, and we then give you a period of stabilization, and we would then come back and perform super user training. This is where our configuration experts teach you how to configure and manage your system, because our goal in either approach, where we're doing the configuration or you're doing the configuration, at the end of it, the goal is that Acuity is your system and you own it and you understand how to maintain it, versus having to come back to us continuously and hire us to manage your system for you. We want you to have the controls. So once you're live and stable and we've trained your super users, we begin to transition into maintenance support. And so we do a post-implementation review a few weeks after you go live, just to make sure that everything that we've set up is working, that your workflows are working the way you anticipated, and we make any tweaks and changes that we need to. Then we go into a period of enhanced support, where we meet with you on a daily basis, just in case there's little things here and there that pop up that we need to manage. We are not making you at that point go through our normal tech support process. We're actually proactively meeting with you on a daily basis. Once you are stable, and again, that's the project team defining that timeline, going back to we meet the client where they are and we customize our approach to the client's needs. We all decide, the project team decides when you're ready to go into maintenance. And then we do an on-site review at the 6-month mark from the go live, again, just to do that check-in. And we find that at times, this is quite commonly the time frame when clients have used the system, they understand the system, and they are themselves now identifying ways that they can do even more things in the system, maybe bringing on different user groups or bringing in other workflows that you chose not to bring in during the initial implementation. So we work with you to achieve those goals. One key element to the transition to support to call out is the fact that TCS's model is that the same people that implemented you, my team, are also your account managers and your tech support. So we're not handing you off so that you're going from one team that knows you and worked with you to do your implementation to another team to manage your account. It's the same people that you're going to be talking to on the phone on a go-forward basis are the ones that did your implementation. So we're quite proud of our implementation process, but even more proud of our client satisfaction. Once go live has been achieved, we still like to get the A+ a year afterwards. Jeff?
Deb, did you want to talk about technical support at all?
Absolutely. So technical support, again, we have a standard process for technical support that we begin to train you during that implementation phase at the end when we're transitioning you to technical support. And again, the process is that you email our technical support staff, and again, these are the same people that supported you during implementation. Our average turnaround time is same day for first response for technical support issues. And we're quite proud of our reputation. We think we knock it out of the park as compared to our competitors.
Great, thank you.
Thanks, Jeff.
Well, hopefully through that you're able to see why we have a track record of 100% implementation success, as well as a reputation of service and a high degree of client satisfaction. So now what we'd like to do is turn back to Jessica and see if any questions have come in that we could answer for attendees. Jess?
Wonderful. Thank you so much for all of the great information, Jeff, Deb, and Linda. As Jeff said, why don't we take a few minutes to answer some questions that members of the audience have sent over. Jeff, the first question I'd actually like to send your way, if that's okay. An attendee would like to know about how many members or providers can be in the system.
Well, ACUITY is has an extremely robust database behind it, and as a result, there's not any limitation on the number of members that can populate the member table, nor limitations on the number of providers that can populate the provider table. And we have clients with databases that exceed millions of individual records.
Wonderful. Thank you so much. The next question is in regard to user training. Deb, how do you train your users?
Thanks, Jessica. That's a great question. We get asked that a lot in the early phases of implementation. So we use a just-in-time training model in that we begin to expose new clients and the end users immediately to the functionality of the system as soon as we come out for our implementation assessment. And then we have, of course, core training for our super user group around how to manage the application and how to configure and, again, own the system once we have achieved go live, or prior to workflow sessions if the client is doing their own configuration. And then again, we have end user training where we partner with the client, again with TCS, providing support on offering the training toward the core functionality of the system with the trainers from the client side providing training relative to specific business operations and desk procedures. But again, it is a just-in-time training approach with verbal, visual, hands-on, and of course written documentation to support.
That's wonderful. Thank you, Deb. The next few questions that we have coming in are really in regard to the system itself. Linda, one of the users or the attendees was wondering if you could show them how to find all cases assigned to a specific case manager, and that's no matter when they need to act on them. So just a full list of case assignments.
Sure. So over on the left navigation bar, the end user can come down to the care enrollment main browse. Excuse me. And then you can look up with the quick filters any items that are listed under your name on the reviewer ID of mine. And so in my case here, these 3 care enrollments come up that I need to work through for these members.
All right, wonderful. And in a similar light, another attendee would like to see how to sort tasks by priority and was wondering if that was possible.
Sure, absolutely. So the My Work list shows all of the tasks that are due for My Work. And as we mentioned previously, the today, tomorrow, and past due items will show up. We can also go down to the task browse for a full list of all of the tasks. And on the left side with the quick filters, choose mine. And then depending on the day you're interested in, you can choose today. And they will automatically show up here in my browse list of items I need to work through today.
Great, thank you so much. I guess the next question that we have coming in is in regard to role-based security and how that's set up. Jeff, did you want to go ahead and field that one?
Certainly. So the role-based security is essentially looking at what an individual user is able to do and who the individual user is able to do it with. So to illustrate that, the what. The what would be what records overall do I have access to, and am I able to only view those records? Am I able to update or edit those records? And am I able to create new records? And then the who is which of the members am I able to do all of those items that I just described in the what. It could be by line of business. It could be by position assignment. So again, the end user's role-based security is going to decide what actions the user is able to perform within the application and who or which members that user is able to do those actions with.
Great, thank you. The next question is probably best answered by Deb. An attendee would like to know if they would be able to speak to some of the existing TCS clients if their company was interested in this software.
Oh, absolutely. We have a wonderful client base that is always excited to talk to new client prospects and share their experiences with us, and we're very proud to be able to say that we consider all of our clients to be referenceable clients. We have everything from just some email exchanges to phone calls to actual clients that are willing to host potential clients coming on site and seeing the software in use. So yeah, we're very proud to offer that.
That's wonderful, thank you. Now we are starting to run low on time, so I'm going to direct one final question towards Jeff, and then we'll go ahead and finish up some closing details before we end the presentation. Jeff, an attendee would like to know how they would go about scheduling a personalized demonstration for their company.
Oh, well, we would be very delighted to do that and have a one-on-one or individualized demonstration of the software. Most commonly, we simply schedule a go-to meeting type of webinar between us and the client. So simply an email or a call to myself. The contact information will be on the screen in just a few moments. Email or call to myself. We generally have a discussion to understand the overall business need and then schedule a webinar type demonstration. And in some circumstances, those demonstrations occur on site as well.
Great, thank you, Jeff. If you asked a question that was not addressed during the live session, a member of the TCS team will be in touch in the next few days to follow up with you. On behalf of TCS Healthcare Technologies, I wanted to thank you for joining us. Please again keep in mind that this was only a brief demonstration intended to review the newest features of the Acuity system. For a complete demonstration of the full capabilities of this comprehensive care management software solution, please email Jeff Frater. His email is jfrater@tcshealthcare.com. And we hope that you will be able to join us for the upcoming April and May sessions. Thank you again for your time, and have a wonderful day.